I think there is a lot of epidemiology, which of course most orthopaedic surgeons can't spell, that is looking at how we divert people from developing osteoarthritis. And there appears to be a very strong genetic element to that. And people say, well, my mum was awful, or her grandma was awful. So there is a definite family history to this. And a lot of people think it's weekend warriors beating up their knees. To a certain extent, it can be, but there's a very strong genetic element into it. And it's maybe addressing that that's more important than with these increasing numbers.
Yeah, and of the patients, it's possibly either a silly or a difficult question to answer. There must be a greater preponderance of active people who are seeking knee replacements, as opposed to, I don't know, we talk about the growing obesity crisis in the country. But then I guess if you're obese and more sedentary, you probably don't need a knee replacement, or you don't really want one. So
that's our issue, actually, is one of the factors that they think is driving these bigger figures is unfortunately bigger people. Right. So we see, I think you're right to characterize them as two groups. We've got, let's say, the sort of 45, 55-year-old tough mudder who still thinks he can, go on weekend hikes and stuff like that. And then we've got some very big people who are morbidly big. So their BMIs are way 40, 45, 50, who are just destroying their knees. And they are not active, and they're not doing a lot of walking, but just the sheer weight is driving their knees, and they are a huge problem. So as everyone knows, as a country, we're getting bigger, as in terms of our BMI, not taller or more handsome, but we're getting bigger. So our BMI is creeping up, and we are seeing that in people's knees.